Are you in early pregnancy, or you suspect you might be, and you're not sure what is normal or dangerous? Maybe you're feeling tired, vomiting, or scared, but you don't know if it is okay or if you should go to the hospital. Stay with me in this video. I'll explain what happens in the first trimester, common symptoms, what you should do, what to avoid, and danger signs you must not ignore. By the end of this video, you'll feel more informed and less afraid. Welcome to Everyday Maternal and Child Care. I'm a trained maternal and child health worker, and today we're uncovering everything you need to know about the first trimester of pregnancy, what's normal, what's not, and what to watch out for. If this is your first time here, hit subscribe and turn on the notification bell so you never miss tips that could protect you and your baby. What is first trimester? The first trimester is the first 3 months of pregnancy, from week 1 to week 12. In this short period, your baby grows from something so small that you cannot see with your eyes, to a tiny fetus with a beating heart, forming the brain, heart, spine, and major organs. This is a very delicate stage. Even though your tummy may not be big yet, important things are happening inside. That's why what you do in these first 3 months can affect your baby's health for life. Common symptoms. Every woman's body is different, but these are very common symptoms in the first trimester. 1. Missed period. The first sign for many women is that their monthly period does not come. This is usually what makes a woman start thinking, "Am I pregnant?" 2. Morning sickness. You may feel nausea or vomiting, especially in the morning, but it can happen any time of the day. Some women vomit only a little, while others vomit a lot. 3. Breast changes. Your breasts may feel full, heavy, painful, or more sensitive. The nipples may also become darker. 4. Tiredness and sleepiness. You may feel weak or tired, even when you haven't done much work. This is because your body is using a lot of energy to grow a baby. 5. Frequent urination. You may notice you are going to the toilet to pass urine more often than usual. 6. Change in appetite and smell. Some foods that you used to like may now irritate you, even their smell, and some foods you didn't care for before, you may now crave. 7. Mood changes. You may feel happy now and irritated or emotional a few minutes later. Hormones are changing in your body, and that can affect your mood. Most of these symptoms are normal, but when they become too much or severe, it is important to see a health worker. What you should do. This stage is very important. Here are simple things you should do. 1. Confirm the pregnancy early. Do a pregnancy test, then go to a health facility to confirm and open a folder for antenatal care. 2. Start antenatal care, ANC, early. Don't wait until the pregnancy is big or until people can see it. Starting antenatal early helps to detect problems like high blood pressure, infections, or anemia early. Get correct information on nutrition, drugs, and danger signs. 3. Take your prescribed drugs. Folic acid in early pregnancy helps baby's brain and spine development. Iron helps to prevent or treat anemia. Only take drugs or supplements given or approved by a qualified health worker. 4. Eat a balanced diet. Try to eat vegetables and fruits, proteins like beans, eggs, fish, and lean meat, whole grains like rice, yam, potatoes, or other local staples. Avoid skipping meals too much, especially if you are vomiting. 5. Drink enough clean water. Pregnant women need enough fluid, especially if they are vomiting or feeling weak. 6. Rest and reduce stress. Pregnancy is not laziness. Your body is doing heavy work. Try to rest when you can and avoid unnecessary stress. 7. Get support. Share your pregnancy with someone you trust, your partner, family member, or close friend. Emotional support can make the journey easier. What you should avoid. To protect your baby, there are some things you should avoid, especially in the first trimester. Alcohol. It can damage your baby's brain and development. Smoking and hard drugs. Dangerous for both mother and baby. Self-medication. Don't take unprescribed drugs, herbs, or injections from untrained people. Traditional mixtures or unknown herbs. Some of them can cause miscarriage or damage the baby. Lifting heavy loads or doing very stressful work. It can strain your body. Skipping antenatal because you feel fine. Problems can be there even when you feel okay. If you are not sure whether something is safe in pregnancy, ask a qualified health worker. Danger signs. Now, this part is very important. Please go to the nearest health facility immediately if you notice any of these. 1. Heavy bleeding from the private part, especially if it is more than a normal period or you see clots. 2. Severe lower abdominal pain or cramps pain that is strong, one-sided, or does not go away. 3. Severe vomiting, when you vomit many times and cannot keep even water or food down. 4. Severe weakness, dizziness, or fainting feeling, like you might collapse or actually fainting. 5. High fever, chills, or severe headache. This may be a sign of serious infection like malaria or other conditions. 6. Bad smelling discharge or fluid from the private part, especially if it comes with pain or fever. These could be signs of miscarriage, ectopic pregnancy, infection, or other serious problems that need urgent attention. Please, do not stay at home, and do not rely on only traditional medicine in such cases. Your life and your baby's life are very precious. The first trimester can be confusing, emotional, and sometimes scary. But remember, you are not alone. Many women have passed through this stage and delivered healthy babies. If you are in your first trimester now, tell yourself, I will take care of myself. I will eat well, rest well, and I will seek help early if something is wrong. If this video helped you understand the first trimester better, please like this video so more women can see it. Subscribe to Everyday Maternal and Child Care for more simple health education on pregnancy, mothers, and child health. Share this video with a sister, friend, or colleague who may be pregnant or planning pregnancy. You can also drop your questions in the comments. I read them, and your questions help me decide what next video to do for you. Thank you for watching, and remember, early knowledge saves lives.